9% of adults in the US have some type of personality disorder, and in Canada, 6 to 15% of the population is affected by a personality disorder, according to the Cleveland Clinic. Personality disorders are an enduring pattern of behavior that strays away from the expectations of the individual's culture, meaning behaviors or traits that are not seen as normative. They are pervasive and inflexible. It has an onset in adolescence or early adulthood. It's stable over time, and it leads to distress and impairment. In this video, you'll notice that some of the personality disorders have shared and overlapping symptoms. That's why the DSM grouped them together by clusters. There are 3 different clusters, A, B, and C. Let's dive in. Cluster A is marked by unusual and eccentric thinking. The first one up is Paranoid PD, which is a pervasive distrust and suspiciousness of others to the point that folks with Paranoid PD interpret the other person's behavior as malicious. This personality disorder begins in early adulthood and presents in a variety of contexts with 4 or more of the following symptoms. Number 1, they suspect without sufficient basis that others are exploiting, harming, or deceiving them. Number 2, they are preoccupied with unjustified doubts about loyalty or the trustworthiness of friends or their associates. Number 3, there is a reluctance to confide in others because of unwanted fear that the information will be used maliciously against them. Number 4, they see benign remarks and events as demeaning and threatening. Number 5, they hold on to grudges. This person is very unforgiving to insults, injuries, or slights. Number 6, they perceive attacks on their character or reputation that are not apparent to others and is quick to react angrily or counterattack. Number 7, they have recurrent suspicions without justification regarding loyalty of a spouse or a sexual partner. Folks with Paranoid PD can be objective, rational, and unemotional. Their emotional affect tends to range between hostile, stubborn, and sarcastic. They can be difficult to get along with, and they have poor interpersonal relationships. They can be overtly argumentative, quiet, or express aloof hostility. And they are guarded, secretive, and cold. Their lack of trust for others causes them to be self-sufficient with a strong sense of autonomy. In addition, they are very critical of others, yet they can't accept criticism themselves. The next personality disorder under cluster A is Schizoid personality disorder. So this is a pervasive pattern of detachment from social relationships and a restricted range of expression of emotions in interpersonal settings beginning from early adulthood. So one has to have 4 or more of the following symptoms. Number 1, they neither desire nor enjoy close relationships, including being a part of a family. Number 2, they almost always choose solitary activities. Number 3, they have little or any interest in having sexual experiences with another person. Number 4, they take pleasure in few, if any, activities. Number 5, they lack close relationships or confidants other than their first-degree family members. Number 6, they appear indifferent to praise or criticism of others. Number 7, they show emotional coldness, detachment, or a flattened affect. These folks have difficulty expressing anger, even in the face of provocation, which contributes to the impression that they lack emotion. Their lives tend to lack direction, and they lack social skills. They will most likely have few friends, date very infrequently, and often do not marry. Their occupational functioning may be impaired when it involves interpersonal interaction. However, they may do very well in social isolation. This disorder is more prevalent in men. The final cluster A grouping is Schizotypal personality disorder. This personality disorder is a pervasive pattern of interpersonal and social shortcomings, which are noticeable by acute discomfort with and reduced capacity for close relationships, in addition to cognitive or perceptual distortions and unusual behavior beginning in early adulthood. one must present with 5 or more of the following. Number 1, ideas of reference, which means incorrect interpretations of casual incidents and external events. They believe that an event that occurs is specifically about them. Number 2, odd beliefs or magical thinking that influences behavior and is inconsistent with subcultural norms. For example, you believe that you have special powers to sense events before they even happen. Number 3 is unusual perceptual experiences, including bodily illusions, for example, sensing that another person is present or hearing voices murmuring their name. Number 4, odd thinking and speech that is unusual. For example, using ordinary words in an unusual way which may only be understandable to the person. Number 5 is suspiciousness or paranoid ideation. For example, these folks may have paranoid ideation and believe that their colleagues is trying to undermine them with their boss. Number 6, inappropriate or constricted affect. These folks aren't able to bring forth a full range of affect and interpersonal cueing, which is required for successful relationships. They operate with others in a very stiff and inappropriate manner. Number 7, behavior or appearances that are odd, eccentric, or peculiar. And number 8, not close friends or confidants other than first-degree relatives. And number 9, they have excessive social anxiety that does not diminish with familiarity and tends to be associated with paranoid fears rather than a negative judgment about themselves. These folks will interact with others. They prefer not to, as they believe they don't fit in because they're different. Many folks with this disorder usually get help for associated symptoms of anxiety and depression rather than the personality disorder itself. Also, cognitive and perceptual distortions must be evaluated in the context of the individual's subcultural environment. And this personality disorder is slightly more common in males. Next, we have cluster B. The first one up is antisocial personality disorder. The term antisocial is always misused in pop culture. People tend to refer to folks as antisocial if they don't want to be around others. For example, how come you're always so quiet? You're so antisocial. However, the term has a completely different meaning altogether. It is a pervasive pattern of disregard for others and violation of the rights of others since the age of 15. Deceit and manipulation are central features of antisocial PD, and it continues into adulthood, and the patterns of behavior has been referred to as psychopathy, sociopathy, or dissocial personality disorder, which is criminal activity. In order for a potential diagnosis, the person has to have 3 or more of the following. 1 is failure to conform to social norms with respect to lawful behaviors as indicated by repeatedly performing acts that are grounds for arrest. Number 2, deceitfulness, as indicated by repeated lying, use of aliases, or conning others for personal profit or pleasure. Number 3, impulsivity or failure to plan ahead. Number 4 is irritability and aggressiveness, as indicated by repeated physical fights or assaults. Number 5, reckless disregard for the safety of others and their self. Number 6, consistent irresponsibility, as indicated by repeated failure to sustain consistent work, behavior, or honor financial obligations. Number 7, there's a lack of remorse, as indicated by being indifferent to or rationalizing having hurt someone, mistreated them, or stole from them. B, the individual must be at least 18 years of age and over. And C, there's evidence of conduct disorder with the onset before 15 years of age. D, the occurrence of antisocial behavior is not exclusively during the course of schizophrenia or bipolar disorder. These individuals are callous, they're cold, and they have a lack of empathy. They have a superficial charm about them and an inflated sense of self. They make poor partners and irresponsible parents. They are impulsive and they may gamble the rent money away. Their child may experience malnutrition, poor hygiene, and be dependent on neighbors for food or shelter. The likelihood of the onset of antisocial personality disorder in adulthood is dependent on the individual's childhood experience. you have to be diagnosed with conduct disorder before 10 and experience child abuse or neglect, unsustainable or erratic parenting, and inconsistent discipline. Someone cannot be diagnosed with antisocial PD until the age of 18. This disorder tends to be more common in men than it is in women. However, there is concern that the disorder is being underdiagnosed in women. Another cluster B personality disorder is borderline personality disorder. People with this diagnosis tend to have low self-esteem, unstable self-image and interpersonal relationships, impulsivity, and difficulty regulating their emotions. These behaviors will start by early adulthood, and the individual must have 5 or more of the following. Number 1, frantic efforts to avoid real or imagined abandonment. Number 2, patterns of unstable and intense interpersonal relationships characterized by alternating between extreme ideation and devaluation. Number 3, identity disturbance, persistently unstable self-image or sense of self. Number 4, impulsivity in 2 of the following areas that are self-damaging, such as spending, sex, substance abuse, reckless driving, or binge eating. Number 5, recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior. Number 6, affect instability and reactivity of mood, which is intense episodic dysphoria, instability, anger, panic, or despair. These usually last a few hours and only more than a few days. It's rare that the mood is relieved by periods of satisfaction or happiness. Number 7, chronic feelings of emptiness. Number 8, inappropriate intense anger or difficulty managing anger. This person may exhibit sarcasm, bitterness, or verbal outbursts. Their anger is triggered when a caretaker or a romantic partner is seen as neglectful, withholding, uncaring, or abandoning. Their anger is often followed by shame and guilt. And number 9, short-term stress-related paranoid ideation or severe dissociative symptoms. This occurs in response to real or imagined abandonment. It can last minutes or hours. These folks tend to undermine themselves when they realize that they've reached a particular desire. For example, saying no to a proposal when the relationship is healthy, or dropping out of college a few months before graduation. They have body image issues, they may experience hallucinations, and they have a strong attachment to a pet or an inanimate object. Premature death by suicide may also occur, especially if there is a co-occurring disorder like depression or substance misuse. Improvement has been shown within the first year of treatment. As the individual reaches the ages between 30s and 40s, there is a greater stability in relationships and vocational functioning. Another cluster B PD is histrionic personality disorder, marked by intense emotional and attention-seeking behavior that begins in early adulthood. It is presented in 5 or more of the following. Number 1, uncomfortable in situations where they are not the center of attention. So if they are not the center of the attention, they will make up stories or create a scene. Number 2, their behavior and interactions are inappropriately sexually, seductive, or provocative. This can be in a professional or an occupational relationship. Number 3, emotional expression is shallow and rapidly shifting. Number 4, they're consistently using their physical appearance to draw attention to themselves. Number 5, they have strong opinions, but they can't provide a rationale for that said opinion. For example, they stated very loudly how much they enjoy their new job, but they can't provide one single reason as to why it's enjoyable. Number 6, they display dramatized, theatrical, or exaggerated expressions of emotion. These emotions, however, can be turned on and off to the point where other people think that they're faking. Number 7, they are easily influenced by others. And number 8, they consider relationships to be more intimate than they actually are. For example, they refer to an acquaintance that they just met less than a week ago as a good friend. Without awareness, these folks occupy a role in their relationships as a princess or victim. They want to control their partner through emotional manipulation or seductiveness, while exhibiting dependency on them. They have difficulty achieving emotional intimacy in romantic and sexual relationships. Same-sex friendships are often impaired and alienated due to sexual provocativeness and a constant need for attention. These folks tend to become bored with the mundane routine, and they often seek immediate gratification. This disorder is more diagnosed in females in clinical settings. However, some studies have shown a prevalence rating between men and women. The last cluster B personality disorder is narcissistic personality disorder. This is a pattern of grandiosity or admiration, a lack of empathy, which begins by early adulthood and presents in a variety of contexts as indicated by 5 or more of the following. Number 1, they have a grandiose sense of self-importance, such as exaggerated achievements and talents. They expect to be recognized as superior without the achievement to back it up. Number 2, they are preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love. Number 3, they believe that he or she is special and unique and can only be understood or should only associate with other special and high status peoples or high status institutions. Number 4, they require excessive admiration. Number 5, they have a sense of entitlement, unreasonable expectations of favorable treatment, or this automatic compliance with his or her expectation. Number 6, they are interpersonally exploitive. They take advantage of others to achieve his or her own ends. Number 7, they lack empathy, and they are unwilling to recognize or identify with the feelings and needs of other people. Number 8, they're often envious of others or believe that others are envious of them. And number 9, they show arrogant, conceited behaviors and attitudes. They have very low self-esteem, which makes them more sensitive to criticism and defeat. These folks don't show this outwardly, but they feel humiliated, degraded, hollow, and empty on the inside. They react with anger, disdain, and counterattacks. 50 to 75% diagnosed are male. Next, we have cluster C, which is characterized by severe anxiety and fear. The first one up is avoidant personality disorder. These folks feel inadequate and they are extremely sensitive to being judged by others. This starts by early adulthood and presents itself with 4 or more of the following. Number 1, they avoid work-related activities that involve significant interpersonal contact due to fears of criticism, disapproval, or rejection. For example, they may avoid a job promotion because they fear criticism, or they avoid social gatherings due to fear of rejection. Number 2, they refuse to get involved with others unless they know for certain they will be liked. Number 3, they show restraint within intimate relationships because of the fear of being shamed or ridiculed. Number 4, they are preoccupied with being criticized or rejected in social situations. They are quiet, shy, and invisible because recognition would be degrading or rejecting. Number 5, he or she is inhibited in new interpersonal situations because of the feelings of inadequacy and low self-esteem. Number 6, they view themselves as socially inept, personally unappealing, or inferior. Number 7, they are reluctant to take personal risks or engage in any new activities because it may be more embarrassing for them. They carefully examine those they interact with. However, their examination of others and tense demeanor may summon ridicule from the other person, which then confirms their self-doubt. They are known to be shy, timid, lonely, and isolated. These folks desire affection and acceptance and may engage in fantasizing relationships with other people. This disorder is equally frequent in males and females. Another cluster C personality disorder is dependent personality disorder, a need to be taken care of that leads to submissiveness and clinging behavior and fears of separation, beginning in early adulthood with 5 or more of the following symptoms. Number 1, has difficulty making decisions without an excessive amount of advice and reassurance from others. Number 2, they need others to assume responsibility for most major areas of their life. Number 3, they have difficulty expressing disagreements with others because of fear of loss of support or approval. Number 4, they have difficulty initiating projects or doing things on their own due to a lack of self-confidence in their abilities rather than a lack of motivation in their energy. Number 5, they go to excessive lengths to obtain nurturance and support from others, to the point of volunteering to do things that they find unpleasant. They may tolerate abuse in relationships, and there is often an imbalance or distorted perspective in the relationship. Number 6, they feel uncomfortable or helpless when alone because of exaggerated fears of being unable to care for themselves. Number 7, they urgently seek another relationship as a source of care and support when a close relationship ends. They believe they are unable to function, which makes them become attached to another person so quickly. Number 8, they are unrealistically preoccupied with fears of being left to take care of themselves. They worry about abandonment without cause to justify said belief. These folks are critical of themselves. They belittle their abilities and have self-doubt. They seek overprotection and dominance by others. Criticism by others is proof that they are worthless, which affirms their negative belief about themselves. Although this disorder has been diagnosed more in females, the final cluster C, PD, is Obsessive Compulsive Personality Disorder. This is a preoccupation with orderliness, perfectionism, and mental and interpersonal control at the expense of flexibility, openness, and efficiency. This begins in early adulthood and presents in 4 or more of the following ways. Number 1, they are preoccupied with details, rules, lists, order, organizations, or schedules to the extent that the major point of the activity is lost. They are repetitive and constantly paying attention to detail in order to avoid mistakes. Number 2, they display perfectionism, which interferes with completing tasks. They won't complete the task because they aren't meeting their own rigid standards. Number 3, the person is excessively devoted to work and productivity to the point of foregoing leisure activities and friendships. Number 4, they are over-conscientious, scrupulous, and inflexible about matters of morality, ethics, or values. Number 5, they are unable to discard of worn-out clothes or objects when they have no sentimental value. Number 6, they will not work with others or delegate tasks unless the person gives in to their way of doing things. Number 7, they adopt a very frugal spending habit for themselves and others because they believe that the money should be accumulated for future catastrophe. Number 8, they display rigidness and stubbornness. There is difficulty making decisions and deciding what tasks should be a priority. This leads to anger because they won't be able to make a decision and they won't be able to get anything done. Their anger isn't expressed directly at the source, but it does come out in situations that are kind of deemed minor. Folks with OCPD can be uncomfortable around people who are emotionally expressive. They maintain control of their emotions and hold back what they say until they believe everything is perfect. This disorder is diagnosed twice as often among males than females. I've worked with clients who want to know if they have a personality disorder, while others have stated they don't care for labels. Some people have said to me that they feel like they're not going crazy and they finally feel heard and seen, while others have mentioned feeling judged and ostracized. As adults, the choice is yours. Being diagnosed with a personality disorder can feel scary, especially if you are unfamiliar with mental health illnesses and you don't have all the facts. You may be shunned by your family, friends, the medical community, and society. In my career, I've heard other clinicians speak poorly about folks with borderline PD, and I think it's more about a frustration and a lack of knowledge and a lack of boundaries when treating someone with borderline PD. Receiving a diagnosis is more than just reading the DSM and identifying yourself with the diagnostic criteria. It is important to speak with a trained professional, a trained medical professional who will provide you with an in-depth assessment. Treatment is definitely available. Reach out to a doctor who is willing to set you up with proper support. If you made it to the end of this video, thank you guys for watching. Comment below what videos you want to see next, and if you're comfortable, comment if you find receiving a diagnosis to be helpful or unhelpful. Don't forget to like, comment, share, and check out my next video. Bye for now.